daughter, Ashley, heard this news, she jumped into the Twitterverse to gather more information. The next day, another 10 people were sent to local hospitals. She called her brothers, Josh in Oregon and Blake in Massachusetts. "They're so vulnerable," she sobbed. "That's 21 total. We have to get them off that ship." "Chill, Ash," Blake told her. "You'd expect one infected person to have that many contacts." "It's flu season," Josh said. "And you know Mom is a maniac about all of us getting flu shots." When there were no new cases announced on February 7th, Blake wrote a group email telling everyone to relax and that Mom is probably using the time to plan her next cruise. Of course, he didn't know that we were sublimating our panic by telling our story to whoever would listen while simultaneously sending the kids upbeat emails and asking for pictures of our 7 grandchildren to cheer us up. We weren't strangers to the media. I'm a best-selling writer who's been on many book tours. I've appeared on all the morning shows and done other national television for both novels and nonfiction. Phil is an award-winning documentary filmmaker who is far more comfortable on the other side of a camera, but he knows what producers want in terms of sound bites and succinct messaging. As boomers in our 70s, we fit into the grandparents on holiday niche, and while hardly influential enough to attract a wide social media following, we were, as they say, relatable. And at that point, the journalists wanted to know how it felt having our dream trip interrupted and how we were handling being cooped up involuntarily. They were especially interested in what the ship's kitchen was giving us to eat. Ashley's Twitter and Instagram friends thought we were lucky to be getting a free cruise out of Princess, which infuriated her because she felt we were in danger. We understood why she was so fearful. She had spent 10 years in foster care before we adopted her at age 12, and her emotional dependence on us was far more intense than that of the older boys. Everything changed on February 8th with the announcement of 41 new passenger cases, a total of more than 60 in less than a week. Any vestige of denial on our part dissolved. Our health was at risk, and possibly our lives. When I phoned Blake, he immediately asked, "How many new victims?" And when he heard the answer, his tone turned from lighthearted to serious. Blake has the classic engineer personality and a reputation for solving complex problems. He's thoughtful, precise, executes plans flawlessly with as little emotion as possible, and always meets his objectives. "What can I do to help you get out of there?" I told him how the media was descending fast and furious, and we couldn't do both the organizing and the interviews. And frankly, I'm creeped out. How are more and more passengers getting sick when nobody has been out of their cabins? They aren't telling us what's really going on. We aren't safe here. We have to find a way to get the hell out of this posh penitentiary. "Why can't you go ashore, where you won't be around whatever is making everyone sick?" "It's the Japanese Ministry of Health. They don't want us contaminating the population." "What about our State Department?" "We get daily messages from the consulate here in Tokyo. They say we're safest sheltering in place." "I get it," I said. I'd not only studied Japanese history in college, I'd lived in Japan as a child. It's an island mentality. They totally control who they let in or out. Blake said we should send everything to him and he'd organize it like a business campaign. "But you're so busy,"